Hey, I'm Dr. Ruth Roberts, the original holistic pet health coach, and with me today is Dr. Jeff Grognet, whom many of you already know. Dr. Jeff retired and turned his life into a whole new direction. So he founded New Earth Vet, and so you can check that out at newearthvet.com. And what he's been doing is creating amazing holistic pet owner conferences. So if you've not yet participated in one of his conferences, when you go check out the website, you'll be able to see what's up next. But what Dr. Jeff has been focusing on is bringing you the tools you need to take care of things at home as best you can, and then get involved with your veterinarian as you need to. So to that point today, what we're going to talk about is pet emergency preparedness workshop, and do a little workshop with you. So Dr. Jeff is going to introduce several concepts that are like the most important things to have a plan in place for. And we pray that you never have to experience this with any of your pets. But if you have an idea about what to do next when these things pop up, you're going to be so much more comfortable during that experience, and your pet's going to do so much better. So, Dr. Jeff, I'm going to let you start talking, and let me know where you need some help. But welcome. Really excited to have you on.
Thank you, Ruth. And yeah, it's great to be here. And I know your audience is, they're really concerned about their pet's health. And you've got great stuff in terms of this is what you do to keep them healthy. All right. And this is what you do, I call it for the chronic stuff, all the and that's medication, supplements, whatever you call that. But the point is, eventually you're going to have an emergency. There's things that happen. And I look at it from my perspective, and that is I try to avoid places like doctors and hospitals. And so the biggest reason to be on prescription medication is going to your doctor. And it's best if you don't go there in the first place, if you can. And so that's what your foundation is all about, as in you're creating that foundation for people to be able to keep them healthy. But with me, I've had dislocated shoulder, kidney stones, broken rib. I wanted to go to emergency. So there's always those things that you have to sort of look at in terms of, hey, and the question is, do I have an emergency or not?
Yes.
That's the biggest question. Can I handle this at home, or do I have to go and see them? Do I have to go into the emergency care? And so that's sort of where we are. And there's some things you can handle at home, and that's what I'm going to be trying to help out on, as in trying to get people to figure out what to do. The first thing, I'm just going to hit this just a little bit, is a pet first aid kit. And the thing about a pet first aid kit is that it's pretty well identical to your first aid kit, as in what you'd have for yourself. And for example, do you have a thermometer in your first aid kit so that you can tell if you have a fever? Just putting your hand on your forehead is not a way to figure out what your temperature is, okay? So it's a lot better if you get something where you can take the temperature. And what I would suggest doing for that is going to the pharmacy, getting a digital thermometer. It costs $10, maybe, something like that. And what I would do is put a letter on it with a black felt that says either a D for dog, C for cat, or P for pet, whatever. So that way, there's no way you're going to take that thermometer and stick it in your mouth. Okay.
Key point.
Yeah, but the key is have one dedicated for your pet. Because when people call me at the vet hospital and say, my cat's not feeling well and he's got a fever, my question always at that point is, what's the temperature? And that's such an important part, okay? So digital thermometer, all you do is lubricate the end. You don't have to get anything special for that. You can use dish soap. You can put a little bit of Vaseline on. Something slippy, okay? And then you stick it in the boom, and you push the button, or you push the button beforehand. It depends what type it is. And it only takes a few seconds, and it tells you what the temperature is, and you've got some really important knowledge right there. So make sure you've got that. The other thing to have, which is really useful, and I've got a full list of the pet first aid, all the stuff in my pet first aid course, if you get into that at all. But the thing is, the other thing to have in there is make sure you have some eye wash. And I'm talking sterile saline. It's used a lot for cleaning contact lenses. So you just go to the store and buy a bottle of it. It's really, really cheap. And that is so useful for being able to swab eyes and clean them if there's a gunk around the eyes. You can also use it to squirt to remove debris. It's just so handy to have on hand. Okay.
Amen.
And the other thing I want you to get, and this is for dog owners, not cat owners, hydrogen peroxide. And you go to the your favorite drugstore. It comes in a brown bottle, and the reason it's in a brown bottle is because if it's exposed to light, it degrades. It doesn't work any longer. So you get that stuff in a brown bottle. It's 3% hydrogen peroxide. And what's that used for, Dr. Ruth?
All sorts of fun things, including making your dog vomit.
Bingo. That's the whole idea. And that's why we can use it in dogs. Cats don't vomit with hydrogen peroxide. It just doesn't work. Okay. But with dogs, and here's the story. One time we had a barbecue on a weekend, and I did extra hamburgers, and guess what? They went in the garbage, which went into the garage. Garbage can was full, so it went in the bag in the garage on the floor. 4 or 5 days later, and this is in the summer, our dog came into the house with this literally green patty. It looked horrible. So it was a hamburger patty that had 5 days in the heat in a bag in the garage, and she brought it into the house. And I just looked at that and I thought, how many have you eaten, buddy? I mean, we're in trouble here, right? This is called impending food poisoning. Okay, so this is a great example of how to use peroxide. I grabbed the bottle and said, her name is Courtney. Courtney, let's go back to the back of the property and then have a visit with you. So I took her back. The dose to start off with a dog is roughly a tablespoon for every 15 pounds a dog. Okay. And she was like a 50-pound dog. I gave her about 3 tablespoons. I didn't measure it very accurately. I was carrying the bottle. I just lifted her mouth, pull out the lip and blip, and she swallowed that down. It only took her about 3 to 4 minutes for her to literally to turn kind of greenish. And then she vomited up a pile of hamburgers, and with the plastic wrap that they were in too.
Oh, good.
Okay, so cleared it out. And yeah, she didn't feel good for the next hour, but after that, she was good. She would have been really sick. Okay,
yeah.
That would be the problem. But I've used peroxide for things like that. If your dog gets into, the number one poisoning in dogs now is marijuana. And if your dog gets into marijuana and you know it, get them to throw up right now. Okay, it's going to help. But you can use it for that. I've actually used it for a dog that swallowed, actually several dogs that swallowed a ball. And that is, they got a really small ball that they shouldn't have, and they just swallowed it down. And what I do with them is I give them a can of canned cat food, and that sort of lubricates everything and give them peroxide, and you get them to throw up. Balls out, you don't need surgery. Great way to do it. Okay, so definitely look at doing that. Something that really helps if you've got a wound, and this can be a wound on the leg of a dog or cat, or if it's on the flank, on the side, on the neck. First off, putting something on that's sterile, and a lot of people don't know this, but you can use sanitary napkins. Really handy to have. And so you probably need a woman in the house to be able to have those. But
or go to the drugstore and prepare, right?
Bingo. Or go to the drugstore and prepare. But they're clean, they're really good, and they're absorbent. Perfect. So you can put those on. And how do we hold them on? You're going to love this one. Saran wrap.
Cool.
Just go and get that from the kitchen. and you put that around, not too tight, but that will hold it in place so that you can keep it clean and not have anything else getting into it as you get to the veterinarian. That's the way I would term it on that one. Okay, so really handy stuff to have. And just to throw one more in for poisonings, if you've got a dog that's gotten into marijuana or something like that, and it's appropriate, what you can give is activated charcoal. You can buy that at the drugstore. There's lots of different brands. I would get one that comes in what I call a big toothpaste tube, and so it's kind of a pasty, liquidy stuff. And then all you do is you can give, there's no toxicity with this stuff. You can give the whole tube to a tiny dog, but the point is a full tube is usually enough for a lab. And so I would just be squirting that in the mouth. Make sure that at that point you're doing it outside or you're doing it on plastic or something, because if that black gets onto your furniture, your carpet, or your clothes, make sure your clothes are kind of disposable or something. You're going to be throwing them away.
Right on.
Yeah.
And to that point, Dr. Jeff, it seems like they're in most of the U.S. pharmacies, they're only in capsules, which can be a little bit of a challenge. But if you're facing that situation, so for that average size lab, how many caps would you try to get down the dog's throat?
Great question. I don't know the size of the capsules myself, but what I'd be doing on that is I would look at, well, how many capsules do you give your average person? And make your average person 100 pounds just so you can calculate things easily, right? And then just say, okay, I've got a 20-pound dog, 25-pound dog. I need a quarter of the dose for me.
Right on.
Okay. Yeah, you're not going to overdose on charcoal. It will make the poop black. So
don't freak out.
Don't freak out. That's the next thing that you're going to see. But there's a couple of interesting things. Two more things you should always have. Make sure you have a leash in your first aid kit, because that's something that you're always going to be looking for if you want to get control of your dog. And if you carry your first aid kit in your car, and I carry it in my truck. It's always there. So, and I have this tiny web leash with a D-ring on it. And that helps. Like one time I was going down the road and there's a Great Dane running down the road. It's like, oh, great. So I pulled ahead, as a blocker. And then I got out and said, come here, buddy. And I got him. It's useful to have. The other thing to have, dog and cat, Elizabethan collar. Because if they get an eye problem, they get an ear problem, you want to be able to put that on so they can't scratch their eyes or scratch their ears. Also, if they damage a foot, like tear off a dew claw on the front leg, it'll prevent them from being able to lick that dew claw and cause more problems. Okay, so definitely always have one of those plastic Elizabethan cones. Not the donut around the neck or anything like that. Get the one that actually will stop them getting to that area. Okay.
Right on.
So there's some ideas for a first aid kit. Anything else you put in there, Ruth? I mean, there's a lot more stuff, but
right. Yeah. I mean, there's so many other things. I love the idea of using sanitary napkins and Saran wrap. So that's a cheap and easy way to do it. The other thing you might have is either a clean tube of like a KY jelly. So for wounds, I like to put that in and then cover it, because it'll kind of keep the wound moist. If you've got it on hand, if you don't, just covering it's going to put you miles ahead. And
if you don't have that and you want to put something on, honey.
That's a great idea too, because it's going to kill bacteria. Fantastic. Yeah.
So there is something you can use for that. Okay.
Well, wonderful.
Okay. So that gives it a bit of an idea. I mean, there's more to put in there. There's bandage material. There's have a blanket that you can use as a hammock.
Right on.
And that, if you've got a dog that can't walk, you can put them on there. For cats, use a pillowcase.
Great idea.
You can put them in a pillowcase. You can pick it up. They're secure, and they're not going to get hurt, and you're not going to get hurt. And so it's really handy to have that. Okay.
Yeah. And no, he didn't say onion, Lisa. So the other thing you can do too is get a bandana, because sometimes when our pets are hurt, especially dogs, if we can gently cover their mouths using the bandana to just kind of keep the mouth closed as you're picking up an injured animal, that can prevent you from getting bitten. So I think that's really, really important too.
It is very important, and that leads us to what I think should be the next topic. What happens if your dog or cat has a seizure? What should you do? Okay, and because you talk about protecting yourself, that's a segue into this.
Right on.
One of the worst bites I ever saw was a guy that had a German Shepherd that was having a seizure. It turned out to be a poisoning back in the days of slug bait. Okay?
Right on.
And this dog was having a seizure and just uncontrolled, and he would just be vibrating like crazy, and the mouth is going up and down a thing. And he read a thing somewhere on the internet that said, make sure they don't swallow their tongue. Okay. So I'm going to kill a couple of myths here. So what he did was that, oh God, my dog can swallow his tongue and then he won't be able to breathe and he's going to die. So he actually put he put his hand in the German Shepherd's mouth while it was having a seizure.
Ooh.
The dog's reaction was to clamp. And like I said, he didn't know if he was going to get his hand out. Okay. And so anyway, he eventually did. He came to the hospital with a bandage around his hand and his dog seizuring. So immediately I knew him really well, and I said, okay, I'm going to be looking after the dog. And I got the receptionist to take him to the hospital because he was in no shape to be driving at that point. He was getting shocky. So big point here. Dogs, cats, people do not swallow their tongues when they have a seizure. Okay? Now that is so important. And do not put your fingers in a dog or a cat's mouth when they're having a seizure. It is a dumb idea. Okay?
Yeah.
Okay. And then the other bite that happened was someone his dog was having a seizure. So it was a big dog too. And he actually sat on the floor, grabbed the dog, pulled him over, and hugged him. Okay. The problem is when he hugged him, the dog's face was right here. Guess what happened, Ruth?
Oh, it's making me curl my toes.
Yeah. Okay.
Yeah.
So yeah, he got bit in the face really badly. Okay. So with that intro, if you have a dog or a cat that has a seizure, okay, the first thing that you do is back away. And I heard something really great from a first responder just a couple of days ago. And he says, you back away to the point if you put the thumb in front, you've got to be able to cover what you're seeing. And that's the distance you should be away. That was more for fires and things like that. But it's great when you think about, okay, just back up for a minute. And so the first thing is, if an animal's having a seizure, generally what you want to do is to protect them. Okay, so let's assume they're on the floor. So the first thing that you do is you pull them by a leg. You do not try to get hold of them to move them. Just use a hind leg and just sort of move them so they're away from furniture and they're in the middle of a carpet or a floor or something like that. Keep them away from stairs. Okay, but get them into an open area where they're not going to hit something. A cat that my mother-in-law had, he had seizures occasionally, and the biggest problem he had is sometimes he was under the table in the living room.
Yeah,
so he was banging on the table. That wasn't cool, So pull him out. Okay, so you can do that. The other side is, as they're having the seizure, get rid of any excessive noise. So turn down the rock music. Okay. Turn off the vacuum. That was the trigger for the little cat that was under the table.
Wow.
Yeah. Yeah, and usually people visiting, but that was what triggered seizures in that old guy. But anyway, turn down any stimulation, turn down bright lights. I wouldn't go putting soft music on. I don't think that's going to help them very much at that point. You can also, if it's bright, get a blankie and just drop it over them. You're not doing it for heat or anything like that. What you're doing is just trying to stop the light from getting to them. So just a dark blanket. And so that's one part. If they're continuing to have seizures, I'll get into that in a second, get them into what we call a sternal position. And that is, if you think of the Sphinx in Egypt, as in their feet, the feet, that Sphinx is the head with their feet down and their head, looking forward. That's the position. That's what we call sternal in veterinary medicine. That can actually prevent, shorten the seizure and prevent the next one, being in that position.
Interesting. Wow.
Yeah, it's a really
cool.
Neat way. Most dogs and cats will have one seizure, like the majority of them, like 75 to 90%, depending. So in that case, okay, we've had the seizure, we're fine. Sometimes they will have a seizure and then they'll go into another one. And that means, hey, we've got a bit of a problem here. That's why I was thinking about getting them in that Sphinx position. And the other side, and I'm sure you've heard of this, is putting a cool something on their spine. And usually what we're talking about is you can have a gel pack from the freezer, you can get a bag of peas, something like that, but you put it over the spine, and this is why it's good to have them in that Sphinx position, because you put it on top of the spine between the last rib and the pelvis. Okay, and that actually can prevent the next seizure from occurring, which is a really neat holistic way of getting into seizure control.
Cool.
So something to think about with that. Have you heard of that one before, Ruth?
That one I have not heard, but that makes sense because there's a lot of associate points for movement and all sorts of things down there in terms of acupuncture points.
You betcha.
Yeah, so that makes total sense.
Yeah, it's a really neat way to do that. And when the emergency clinic, which is totally conventional, was doing that on seizuring animals, I thought, wow, that's really neat. I wonder how they decide to do that without the evidence around, But they did. They were doing that. So the key is protect yourself. Make sure you don't get nailed. Protect the animal. And if it's a one-time job and they just have the one and then they seem to recover, and some will recover in 5 minutes, other ones take a few hours. Most of them are very disoriented, and they may even appear to be blind after a seizure. And as long as that turns around, you're fine, and it usually does. Okay, but if they're having repeated seizures, that means you have to get to the hospital, because they've got to have real medication to stop them from occurring. And if they just have the one, then it's a question of, okay, and it's never happened before, it might be time to get in for a visit and get some blood tests done and find out what is the reason that happened.
Right on.
Okay, yeah, but that's a very common, unfortunately, a very common thing that we see. And preventing seizures. You're going to love this part, Ruth. The biggest thing I would do in terms of preventing seizures is avoiding toxic insecticides.
Amen.
And the newer generation insecticides that we're seeing these days are scary because they maintain blood levels for a long, long time. And there's certainly good evidence now that some of them are actually creating epileptics that weren't before. And even just from one dose, they turn into an epileptic, and then they've got lifelong control needed after that. And so,
yeah. Thankfully, the FDA did finally put a black box warning on these products that says this may increase the risk of seizures. I'm not sure. Have they done that in Canada yet?
We don't have an FDA in Canada, eh?
Similar entity, right?
Yeah. Well, yeah, we do have the CDC, but they're kind of slow on that, and I don't know how much they'd be rushing to do that stuff, but I'll have to check if if it's starting to happen. That is fantastic.
Yeah, no, they did do that, I think, a year or so ago. But
Yeah.
right on.
Yeah, I do love that idea. But yeah, that's in terms of preventing them from occurring, then that's the number one thing I would do now. And then the rest of them just occur just because epilepsy can be genetic, as you probably know.
Right on.
Yeah.
And before we shift topics, Lori's actually got a great question. How would you handle vomiting during a seizure so the dog doesn't aspirate?
Okay. That actually doesn't happen that often, thankfully. It seems to occur more in people, and that is a concern. So in people, what you do when a person's having a seizure and perhaps vomiting is you turn them on their side or you turn them on their belly. Okay, and that stuff, if stuff gets in the mouth, it goes out. Okay. If a dog looks like it's vomiting or something like that, I would do exactly the same thing, and that is I would get them on their side, and that way, hopefully stuff will go out. I'm going to caution, and that is if they're having a seizure and they're vomiting, don't put your fingers in there to try to do a mouth sweep.
Yep, exactly. So if you can get this guy into a sternal position, really that's going to solve most of that issue as well, right?
Yeah, and a lot of times if they're in a sternal, they probably won't vomit.
Right on.
As in they may be looking like they will, but they probably won't physically finish it, as in the stuff will stay inside. Okay.
Yeah.
It's usually the time after that's the concern.
Yes.
And that is they finish the seizure and things look clear. And dogs don't lie on their back, thankfully, unless they're really relaxed. My dog does when he's on the couch. But with a seizure, they don't lie on their back like a person would. And so, I mean, if I'm lying on my back seizuring and then I vomit, the stuff is right there and I'm going to inhale it.
You're in deep trouble. Right on.
Yeah. Okay. Whereas dogs don't naturally get in that position. So a great question. But that's probably part of the reason we don't see them vomiting that often. And if they do, it's just a case of keep the head down. So if you've got a dog the size of Hio there, you're just going to pick up Hio and have the head pointing down and even just do a bit of shaking to get the stuff out of the mouth.
Right on.
That's the way I would do it. Okay. Don't use water to flush it because that's just going to create more stuff that can be inhaled. So don't do that type of idea. Okay. Right. Yeah.
Thank you.
But great question. So thank you, Lori. Okay. So the other thing sort of tied to all this is CPR. Do you know how? Of course, you know how to do CPR in dogs and cats, don't you, Ruth?
Sure. Unfortunately, one of the things I was doing on a regular basis in my early years of practice.
Okay. Yeah, that was the first course that I ever taught for pet first aid. And it was actually, it was all centered around CPR, which is great, so I had a lot of fun doing that. And it hasn't really changed very much over the years, thankfully. But when would we need to do CPR? Well, the time, and I've seen this a couple of times now, and it's worked, dogs that fall into swimming pools. Okay, and that is, they go in and then they're floundering around and the next thing they're going under or something. And I've had people that have actually pulled them out and been able to do their CPR. And the other time that, and this was a successful one as well, a puppy that bit an electrical cord that went to the tree lights, Christmas tree lights.
Yeah.
Okay. Like chomp, zzz, and all of a sudden, our dog isn't moving, So that brings up the first thing. Make sure it's safe. So if there's an electrical cord, pull it out the wall. Okay. So you don't join the dog. Okay. That type of idea. Or the other side, as they always say, is a dog that's been hit by a car. Don't go into the middle of the road when the cars are going by you. Okay. Just make sure you're safe before you do anything. So here's the key. CPR is used when you have an unresponsive dog or cat. That's the way to describe it. And what I mean by unresponsive, if you go along, and this is a really easy test sometimes, and this is important when you have a 14-year-old dog that's blind and deaf. And that is, just go to a hind foot and just get hold of the foot and squeeze the toe or pull the leg and see if there's a response. If there's no response, okay, we've got a problem here. There's something isn't working. Okay, and what I mean by squeeze it like you're trying to hurt it. I mean, not initially, because if you get a response real quick, you're done. But it's like, gee, there's nothing happening. The dog isn't looking at me. There's nothing going on. Squeeze it really hard where you think you're going to be hurting, and see if you get a response. And if you don't get a response, okay, we've got a problem here. We've got to keep moving on this. And so the next stage with that is you want to see in people land, what you're going to be seeing is sometimes I call it the old way, was you check the pulse and you see if there was breathing and things like that. In people land now, you actually move straight to doing cardiac compressions. You get rid of all that stuff beforehand. And in Dogland, I pretty well agree with that. What I would be doing, this is my modified version, is I would get hold of the mouth and I would open it just to see if there's anything in there. Okay, now when you open the mouth, you're going to find out if there's any activity in the muscles or anything. Because if you start opening it and the dog says, or a cat says, oh, I'm going to bite you, you don't need to do CPR.
Great.
You're already there, okay?
Right on.
But if you open up the mouth and it's slack and you can do it, and the tongue's just falls out the side. Oh, we've got a kid that's not. Hey, there's no response here. That's when it is also safe to do a mouth sweep. Okay, so you make sure you can do it before you do it. Okay,
right on.
You do a mouth sweep, and then the other thing that you can do with dogs and cats is to do a test breath. And I would do this. And the reason you do it is to find out, is the airway working? And all you do is you get the muzzle, pull the lips down on each side, and then cup the nose so that you've got the mouth closed and the lips are sealing it. And then what you do is you blow in the nose. And for those of you that are squeamish, you can put your hand over, you can grab the whole muzzle and then blow in here, as in, and that's attached to the whole dog, so you're blowing in the nose that way. Or if you're not squeamish, because you're not going to get anything from your dog or cat doing this, just do, I call it mouth to nose resuscitation, and just put your mouth on, blow in, and watch the chest go up, watch it go down, bingo. If that happens, we have an airway that's working. Now we have to work on the heart. And I wouldn't, and so if you've done that and there's still no response, because sometimes giving a breath will actually turn them on.
Right, sure you stimulate the vagus nerve.
Yeah, I'm sure you've seen that, Ruth. And that is,
right on.
You give a breath and all of a sudden they take a breath.
Oh,
all right. Okay, just keep watching. Good. Okay, but if there's no response, you're in trouble. Then you can do CPR, or then you can do the cardiac work, cardiac compressions. And there's two ways to do it. If you've got a dog that's the incredibly sized like yours, and you've got hands the size of mine, you can and this works with cats beautifully. You can actually grab the chest, and they're lying on their side. You come underneath and you grab the chest, and literally just doing that right behind the elbows is where you're doing it. Okay. Rate around 120 a minute. So now there's 2 per second. So now there's 1,000, 2,000, 3,000, right? 2 for every 1,000 is what you're going to do, roughly. Or if you've got your music all timed up, you get the Bee Gees song "Staying Alive."
There you go. Perfect timing.
Do, staying alive. Staying alive. Okay, just keep on the beat. That's the rate you're using. If you've got a larger dog, then you're going to be on the floor. You're going to be over them like you will have a person. You're going to put your hands together, push down, elbow straight, and you're going to put your body into doing the compressions at the same rate.
Right on.
Okay.
Now, Jennifer's got an interesting question. Can you give a breath too big for a small breed and actually hurt them?
Yeah, that's a good one. You're going to be first off, when you give a breath, it's going to be leaky anyway. So you're going to see air fluttering out the mouth and stuff like that. But yeah, you technically could hurt them. But think of it blowing up a balloon, right? And that is, you're not doing it to see how big the chest can go. All you're doing is giving enough to watch the chest come up, and then you let that off and it comes back down. So you're not blowing with any pressure. Okay, you're just blowing to get air in. Okay,
just to see if the airway is open.
Yeah, and certainly when you're doing CPR, and here's the shift that's happening in dog and cat CPR now, and it's kind of the same as people. In people, all you do is the cardiac compressions, and you don't give breaths anymore.
Huh.
And the reasoning for that is as you're doing the compressions, going like that, air is going in and out of the lungs. And in larger dogs, it makes sense that would work for us as well. And in the smaller guys, you may need to give them some air. And that's where we do the things like 15 compressions, 2 breaths. Okay?
Got it.
And that's the way. And in the CPR course I've got, it goes through on how to do that. And as a single rescuer or as with 2 people. Okay. And there's ways to trade off and do that. But yeah, in terms of giving the breath, in that case, you're just blowing it once. You're just seeing if the chest rises. This isn't a competition to say, okay, let's see if I can blow this kid so big. You're not trying to blow them up so they can go up into the heavens. It's not the case, okay?
Right on.
You go slow. But the key is to try to figure out what you're doing. And if you get on the internet, you're going to see some ideas on that. So that's called the easy, cheap version. Just try and see how you can do that. The question I always ask is, how long do you do CPR? This is the same that's in people. And that is, if I'm doing CPR on somebody, as in somebody who just we assume had a heart attack or something, when do we quit? We quit in the terms of per people, we quit when we can't do it anymore. That's it, okay? With dogs and cats at the hospital, and this is how we did it, is that, yeah, we're going to keep going and we're going to be monitoring heart activity. We're going to be seeing, does the heart start? Do they start breathing at all? Things like that. Generally, with dog in the hospital setting, once we've gone 10 minutes and we've had successful CPR, but we're not getting a response, generally we're in trouble. And what I mean by trouble is that, the brain probably hasn't been getting enough oxygen, and we call it brain dead. And so that's usually the signal. The other side is, though, and this is the difference between you and me and your dog. I could have a heart attack, and doing CPR may be something that'll keep me alive, and then they can help me out. If your dog has gone into this type of thing, it's usually not from a heart attack or anything like that. It's usually something far more serious. And the chances of recovery are really low. Okay. The most common reason in the vet hospital for having to do CPR is, do you remember, Ruth?
It depends on what's going around, but for older pets, undergoing anesthesia was one of the more common reasons I saw.
Yeah, it's called, we called it, this is when I'm on a grievance and ethics panel. We called it TMA, too much anesthetic.
Yeah.
And that's the reasoning in hospitals, which is something you can get around.
Yes.
Depending on the anesthetic that was used. But yes, that's the reasoning in hospital land. Okay.
Right on.
But but at home, you put this, and this is the big part. You will not do any harm doing CPR. Try it, because I've been teaching this for a long time, and I get feedback from my students, And what they tell me is that, hey, it worked. Perfect. So they've got a dog or cat that's alive that it wasn't going to be if they hadn't done it.
Because they made the effort. Cool.
Okay. So learn it.
Yep.
And be ready to do it. It's the same in human land. I've taken the courses for human CPR, and the line always is, I hope you never have to use this.
Right on.
Because it's scary. It's really scary when you do.
It's a heck of a responsibility to take on, for sure.
Yeah.
And I think with our pets, Laura's asking about if during compressions it's possible to break a rib. And you can, but it's much less likely. And especially because the pressure that you're applying is a little more distributed over the chest. Has that been your experience, Dr. Jeff?
Yeah. The way it's termed in people, most of the people that need CPR are older. And they have, as they call it, crispy ribs. And so there's a very good chance of breaking a rib. And there was one that I was just a little bit too late to help because the ambulance arrived. But I went to a restaurant, and the owner of the restaurant was doing CPR on this guy. Right?
Wow. And
the guy survived, but in the process, he found out he broke 3 ribs in the process.
Yeah. Okay. So still, it's better to wake up alive with 3 broken ribs than not wake up.
Exactly. But dogs and cats do not have the same crispy ribs that an older person has. And so you're not going to break ribs as easily. Is it possible? Oh, yeah, you can do it. And I worked in my vet school days, I worked at a pathology lab. And there was a situation where a dog was brought in that had died at the vet hospital. And they had done CPR on it. And they wanted to find out why it had died. It had died. It had died. That doesn't sound very good. It passed away because it had a great big tumor in its belly, which they hadn't been able to even get to because when the dog arrived, it crashed on them. Okay. Right. And so, but anyway, we found out why the dog had really passed away. But at the same time, they tried doing CPR on it and they broke ribs.
Yeah.
Okay.
And I think that's when it happens, when you're getting really desperate and you're at a situation where there's no loss going to occur.
No.
Yeah.
No. Yeah. But I think it occurs less in dogs and cats. Yeah.
Right
on. For sure. Yeah. There is that risk. And that's when I come. So what?
Yeah.
Do it. Okay. Just that Nike. Just do it.
Just do it. Just get it done.
Okay. Cool. Okay. But anyway, CPR is a neat thing to be able to do. And once you sort of learn it, then you're on your way. It's going to help out. Okay. There's a couple of things that we can look at, and I've got a dog one and a cat one, so I can hit sort of both audiences here. And one is bloat. So that's going to be the dog one. Okay?
And that's no fun whatsoever.
No, I hated bloat cases. Now, just to put this in definition, bloat the technical definition is that the abdomen is swollen. Okay, that's all that means. Okay, and so I actually saw a Cocker Spaniel that came in because it was bloated. But the reason it was bloated is because it opened the cupboard and got into a full bag of dry food and said, "I wonder if I can eat the whole thing."
Yes, and
this dog was just like a sausage with 4 little legs. I mean, it was just, I couldn't imagine it even eating that much, but it did. Okay. And they brought it in because I think he's going to explode. And I actually took a radiograph of it and I looked at it. All we saw was food. It was all food. And I said, well, we could make him throw up, but that probably wouldn't be feeling very good. And he seems fine. So he went home overnight. It started to go down. And the next day he was hungry again. But anyway, the point is that is bloat. Okay. So bloat means that something is getting bigger in the belly. There's another condition called a torsion. Okay, and that is where the stomach flips, totally flips. Okay, and I think of this like if you're making sausages. Most people don't do that, but imagine making sausages. The way it's done is that you flip them around, and the sausage casing kind of shrinks down, and you end up with a sausage link with a twirl at the end, right? That's what happens to the stomach. It flips, and then the entry and the exit from the stomach closes off. And that's what bloat turning to a torsion is, okay? The technical fancy name we call it is gastric dilatation volvulus. Gastric means stomach. Dilatation means it gets bigger. Volvulus means it twists, okay? So it's called GDV. When that happens, you've got a true emergency on hand. And that's why I want you to be able to recognize this guy. This is confined to larger dogs, technically what we call deep-chested. And so think of a Great Dane, Weimaraner. Okay, they're your poster childs for bloat. And I'm going to use the term bloat. I threw that in intentionally because most people refer to the torsion as bloat. And if you get on the internet, you're going to see it called bloat. Okay, but I want you to know the distinction, just so you know, just in case you see confusion out there. But anyway, big, deep-chested dogs. Here's a neat one. Bassets are deep-chested dogs. They just don't have legs. Okay.
Yeah.
But they're prone to it. Okay. They're right in there. You don't see this in a Shih Tzu, a Cocker Spaniel, or that type of animal. Okay, border collies don't tend to bloat. Okay, so it's a really big guy. Shepherds are right there. Golden retrievers can be thrown in that bunch. But what happens is that the both ends of the stomach don't open and close properly, and air builds up. And the debate on where the air comes from has been going on since before I became a veterinarian. We still don't know where the air comes from. My suspicion is it's because of swallowing it, but they think also it's produced in the stomach as well. And no, there's no research to figure that out. No one's ever told me where it comes from. But the problem is this: as the stomach flips and it gets bigger and bigger, then what happens is the blood from the back end of the body can't get to the front end of the body because that's put pressure on what's called the vena cava, which is the vein that takes all the blood from the back end and sends it to the heart. Okay, so because of that, they go into shock. And all the organs in the belly are twisted all around, so the pancreas starts producing stuff that wants to stop the heart. There's a thing called myocardial depressant factor, MDF. And so that can all have implications, as in we're in trouble. What you see in these dogs is the belly swollen. They're trying to vomit, but nothing's happening. Usually they're drooling like crazy, and they can hardly walk. And by the time they get to the vet hospital, this is how I usually told people. If they can walk in, as in they can come in under their own steam, we've got a 50% chance that they're going to walk out of here. If you have to carry them in, that number goes way down. We're in big trouble. And at the vet hospital, what we have to do with them is to get that stomach to decompress. I always just got a large needle and stuck it in, and you smelt all the gas coming out, and that took it down. That's the emergency treatment done at the vet hospital. Okay.
Right.
Thing you can do at home, and this is possible, and I've had students that have done this. So I know that my teaching worked. You can actually tube a dog at home. Okay. Have you ever taught people how to do this, Ruth?
No, I have not.
Okay.
We're all ears.
Yeah, and this is in my pet first responder course. Okay, so if you want to, you can take notes, but you can find it in there as well. But what it is that if you recognize, there's two things. If you recognize your dog is going through this process, and you're more than half an hour from the vet hospital, it's very worthwhile to do it. If you're 10, 15 minutes away, get the dog in the car and get your butt to the hospital right now. Okay. But if you're half an hour away, or you're on an island and the only vet there is, gone for the weekend, this is what you can try doing. Okay. So what you want to do is you're going to be getting a piece of tubing to get into the stomach to deflate the stomach. That's what you do. And I did this at the vet hospital before we did surgery. Okay. So I know I've done this many times. And so what you're going to do, first off, when you're doing this, you've got a dog that's kind of wants to check out on you. They feel horrible. They don't have much strength. And so this is not that hard to do. All these dogs are large. And so if you happen to have a 1/2 inch diameter piece of clear pipe, use it. If you don't, and I bet you don't, you get a piece of hose. So go out and get one of your garden hoses. And it doesn't have to be anything clean or fancy or anything like that. This is an emergency. You cut a piece and get a piece about 8 feet long. And then what you do is you measure it from the end of the back end of the ribs to the nose. And then just put a mark on it or put a piece of tape on it or something. That is how much you want to put in the dog. And then what you're going to do from the front end, and this is the easiest way, their mouth is filled with saliva. You do not need a lubricant.
No.
Okay? It's wet, it's sloppy, and I'm sure you've seen this, Ruth. I mean, they're just a gushing mess of saliva, ropey, thick saliva. And so what I do with them is I get a towel, a hand towel, just a small one, 2 feet long. Roll it up, put it into the mouth, and then grasp it below the jaws. And then you can use that to sort of open the mouth safely. And then you get your tube, pass it over the towel down to the back of the mouth, and you start pushing it in. Once it gets to the back of the mouth, they will swallow it. And there's only 2 places this tube can go. It'll either go into the lungs or it'll go down the esophagus into the stomach. If it goes into the lungs, they're going to start coughing right away. And just for the record, I've never done that. I've always been going down the esophagus. Have you ever hit the lungs doing a tubing in a dog, Ruth?
No, not in a dog that's awake. I mean, and that's the thing. If you're passed out, it's a different story. But in a dog that's at least still with us, no, you're going to straight in the.
You're going to see that in all the books. But the point is, no, your chances are you're going to go straight down. You go down, and you're going to find a place of resistance, which is that place where the stomach is twisted into that sausage thing. See why I told you about all this stuff? And so you're going to hit that. And there's a couple of things that you can do. One is just put pressure on it and just see if it'll slide in, and you will feel it slide in. Okay, that's one way. And the other way is, as you have it down there and it's just not making progress, 2 things you can do. One is you can get the dog and roll them a little bit to see if that will relieve anything and get the stomach to untwist a bit that you can get in. And the other side is you get your mouth on the end of the tube and you blow, so to try and increase the diameter down there that it might go through.
Right on.
And then if it goes through, you will know in seconds.
Yes.
And what happens, Ruth?
Oh, well, you get this lovely perfume of gas escaping. And I'm saying that in all seriousness, because then it's like, the dog is going to feel better instantly. And then whatever fluid is in the stomach comes next.
Yeah. And usually it's an explosion of, comes out, and it's like, God, that stuff stinks.
Yes.
And then maybe the food will start going. And what I've done with a few of those at that point is I just go, and you'll see the stomach, you'll see the belly go down. Okay.
Yeah.
It'll stop. And sometimes it's because there's food in the tube or something. So what I do then is I go and give them a big bear hug around the belly and try to get the stuff out. Okay. And eventually it'll stop, but the belly's down. Hey, we just got through the emergency part here. And at that point, you kink the hose or put your thumb over the end, pull it out, and then say, okay, your emergency isn't over.
Run like crazy.
Now it's really time to get your butt to the vet hospital. Okay.
Yeah.
So that's the key with that. Always be ready to get there. I've had people that have tried to do this on their way to the vet hospital. when you're jostling around in a car, it's not easy to do this stuff. Okay, so I'd rather do it at home and then get going. Okay, so but that's the thing on the torsion, which is secondary to the bloat, as in the swelling. I hope it's just like my first aid course. I hope you never see that at home, but if you do, that's something that you can do. Okay, it does work. And now we're going to hit a cat thing. Blocked cats. And
the most fun thing ever.
Yeah. And this again, the point is, I want you to recognize this so you can say, oh, I've got an emergency. I've got to get to the vet hospital. This is the point with this. So a blocked cat, what we mean by blocked is their urinary system is blocked. They cannot pee. And so the reason that occurs, Ruth, is due to what?
Pick your poison. So mucus, crystals, stones, chronic inflammation, some combination thereof.
Okay, so it's something that's going down that tiny urethra, which in male cats, because of, and I can say this because I'm a guy, because of this annoying little appendage called a penis, the diameter in there can go down to 2 millimeters. I mean, it's so tiny, okay? And then as you get something goes down and scratches it and causes a little bit of swelling, bingo, you've got a blockage, okay?
Yep.
And the reason why that stuff is there in the first place is because you have poor bladder health. And the big reason for it when I became a vet was they're fed dry food. And then they modified it. They're fed dry food with a lot of ash. And then they said, no, it's actually dry food with a lot of magnesium. And you're going to see all this stuff on the internet. And this is the evolution of how we tried to define the problem. And then it became, oh, this because of mineral supersaturation coefficient is too high.
Of course.
Yeah. Okay. They really made it very technical. But the biggest hazards is you're feeding a dry food. So there's not enough moisture.
Period.
Urine's too concentrated. And therefore you're forming crystals. You're forming, you can call them tiny stones, but they're crystals in the urine. And those are blocking the urethra. Okay. And so what happens then is that the urethra is blocked and the cat can't pee. Now, this does not occur in female cats because their urethra, they don't have a penis, so their urethra is nice and wide. So when they pee, it just gushes out. And so we don't get blockages in the girls. Okay?
Oh, we do, but it's pretty rare. I actually had 10 female cats in my career that obstructed.
Oh. I had one, but it was due to a bladder stone, not crystals.
Exacto. Different mechanism for females.
Yeah, slightly different mechanism. And so, yeah, when we're talking about the crystal thing, it's a guy job, for sure.
Exactly. Yeah.
Yeah. But anyway, the point is that the penis is blocked. They cannot pee. So the consequence is the bladder gets bigger and bigger. Okay. So rather than this nice, soft little almond that can get to the size of a, peach pit or something like that. That's the sort of the normal sizing of the bladder. But at this point, it's the size of an orange, or it's going to get bigger than that. And so the point is the urine isn't getting out of the body. The bladder's stretched, so it's really painful. And the consequence of that is the cat will try to pee. They really do. And they'll go to the litter box and they have this really plaintive meow. And if you've ever heard it, you'll know exactly what it is. It's kind of like a meow. Like it's kind of a growl meow. You know what I'm talking about, Ruth?
Absolutely. It's just, it's like there's no mistaking it. They're like, help me now. Get this out. Yeah.
And they try to pee, but they're kind of make these really funny vocalizations. And this is the key. They go to the box, they try to pee. You can check the box. There's nothing there. Okay, so the box has to be kind of clean for you to figure this out, but that's how you do it. The other thing is they'll go to weird places, and their favorite is going into bathtubs.
Yes.
and they will try and pee, and either nothing will come out, or you may see a couple of drops of blood, which is blood-tinged urine. Okay. Why do they go there? I think it's because the bathtub is cool, and actually they're putting their penis on the enamel, and I think it's kind of soothes it a little bit. But that's just my thinking. Any other ideas on that, Ruth?
That sounds about as logical as anything else.
Yeah, yeah. But anyway, they go in strange places, really strange. And so the key with that is that they're trying to pee. If you get hold of them and put your hand under the belly and just feel and put any pressure on, they will tell you. That's when you get that cry. Okay, and also you may be able to feel, oh, that's that big. What's that orange doing in my cat's belly?
Right
That's
on.
why. Okay, and then as the bladder gets bigger with the urine, the kidneys can't get the urine down the tubes, they're called the ureters, to the bladder anymore, so the kidneys shut down. So from blockage to death is usually less than 72 hours. Okay, and so this is a true emergency. So if you see that, that means your kitty has to get to the vet hospital and has to get catheterized or something like that. Just so you know, at my hospital, usually what we do, because these guys are not feeling well. They're not fighting you at this point, unless it's a really bad cat. Most of them are more or less flat out going, God, I feel horrible. Yeah, I know, buddy. And most of them, I say 80% of them, I was able to just put a little catheter in and back flush, and then run the catheter in without an anesthetic.
Yeah.
Okay, and that way we avoided the anesthetic, which I always thought was a great idea. Occasionally we needed it. Okay.
Yep.
But it's something that you can try doing. Of course, I'm talking to you as a pet owner versus a veterinarian. I should be telling veterinarians they can do it, because most of them don't know that.
Exactly.
Yeah. But anyway, that can be done. The real key for you is, how do we prevent it?
Yes.
And if you haven't been listening, I'll say it again. The reason they're there most of the time is it's because it's a dry food issue.
It's the worst thing we ever did to cats.
Yeah. And so the main thing is, you should not be feeding dry food, period. You know, as in that's gets that out the way. And so you should be feeding, if you're going commercial, you're going canned food. If you're feeding a real food, as in homemade or raw or something like that, great, because cats get most of the moisture from their food. They are not great drinkers. Okay. Yeah. So we want to get them feeding that food. And this is very important. If you've had a cat with a blockage, and so then, in other words, they're sort of predisposed to this, what you want to do then is to get the urine concentration way down. This is the idea for people. I think I mentioned, maybe I did, that I've had kidney stones. What's the solution for kidney stones for people? Ruth? The
solution to pollution is dilution.
There you go. Okay, so yes. So this is what the emergency guys tell you when you go in for kidney stones with people. And that is, I'd like you to drink 12 glasses of water a day. All right. Is there any other thing that I should be doing, Doc? No, just drink the water. Oh, okay. And that's the key. When you have a cat that's been blocked, that has had the crystals, so they're predisposed to it, the solution is dilution. And the way we do it is by adding water to the food. Right. And the way I describe it is this. If you have a can of cat food, so it's already wet, it's 80% water already, you're going to add another can of water to that food. 1 to 1. Don't do it all in one day. Okay.
It won't work, and they won't eat.
They won't eat. So just add a little bit to start with and start making your soup. And with your diet, the crock pet one, you can add water to that.
Absolutely.
Piece of cake, right?
Easy peasy.
Yeah. And so the point is, you're trying to make it so that, and if you're into data, you want to quantify this thing, you want the specific gravity of the urine less than 1.020, what we call 1020. If it's higher than 1025, they can form crystals. Okay, so you want it less than 1020. And that is a very easy thing. A lot of people have these things to measuring battery acid or wine for their production. That tool might be able to check out your cat's urine. I don't know if it'll work.
Actually, somebody was showing me the other day, you can buy a refractometer, which is the little tool that you use to measure the specific gravity on Amazon. So if you've got a cat who, of course you can, who's happy to give you a urine sample, it's a great way to know how things are going without having to go to the vet, get another urine sample done, all of that stuff.
Fantastic. Okay. Yeah. So that's the way you're going to prevent the crystals from forming. And so definitely let's work on doing that with our cats. The first thing you should always do is get them onto I call it wet food of some type.
Yes.
And keep them on.
Dry completely away.
Yeah, and do that. And that way you can prevent pretty well most of these problems. A lot of people just don't take that seriously. And I did that in practice. And that says I'd have cats come in, they were blocked. And, by the time you did the catheterization, you've given fluids, you've done, a lot of times now it's compulsory to do blood tests and urine cultures and all that crazy stuff. By the time you're getting out the door, you've got $1,000 bill, boom.
Easy. Yeah.
And then you tell people that, we want them on this canned food only. And they go, oh, the cat doesn't like that.
And they are tough. I mean, in all fairness, cats are tough to convince to eat something else for sure.
Yeah.
It's a process.
It's a process, yeah. And there's lots of ways to introduce, I always say start with canned food, and then we'll make our way to something else. But yeah, you've got to persist, you've got to work on it and put the energy into it. But the point with it is simple. You don't want your cat to suffer and you don't want another big bill.
Amen. Well, Dr. Jeff, this has been a ball, and I am so glad that you were able to come and present all these topics that are, these are the true emergencies, and these are the ones where you really must know what you're doing, know what's going on, and be ready to go. But you've mentioned several times that you've got a course. Lori took your CPR course last year. How can folks get a hold of you and find more information? And I'm going to drop your website in there, but if you need more info about how to protect your pet from these emergency situations, I'll let you explain the course.
Sure. Yeah, I've got a pet first responder course, which I've had for decades, like 3.5 of them. And I used to teach it at college, and then we morphed into online and all that stuff. But anyway, that's available. And so it has complete CPR. It's got everything that you need to know at home, in terms of cuts, burns, vomiting, diarrhea, you name it. It's got everything
all the fun
stuff. What I've done is because of this is your clientele, Ruth. It's usually $169, but I've got it, and I gave you the link, and I'm pretty sure you have it below in the wordage below now.
Hannah will get it in there. Yep.
Perfect. And anyway, it's on sale for $97, and I'll keep that going till next Sunday, say. Okay.
Cool.
So if people want to get that, there it is. Go for it. If you want to find it another way, go to my website, newearthvet.com, and if you click on the catalog, it's in there, along with all the other courses I've got. But it's in there. And I've got that price in there as well. So you don't need a discount code or anything like that. It's just going to be there. And then Sunday, I'm going to bump it back up to the regular price. So make sure you snaffle it before then if you're interested. But that will get you prepared. It will help you save money. And that way, as I say, you'll be ready, but hopefully you'll never use the information.
That would be beautiful. Cool. Well, Dr. Jeff, again, thank you so much for coming and spending time with us today. These were amazing topics, amazing tips. I hadn't thought about the garden hose thing for bloat, but it makes total sense because, boy, that would be marvelous.
Yeah, it's really useful to have that. I would prefer for people with large dogs to have a bloat kit ready. So they go to the store, get the half-inch diameter tube. Get a piece that's 10 feet long, so you've got lots.
Yep.
And also that way you can cut the end off, and then you can get a lighter or something and burr the end so it's nice and smooth.
Smooth, yeah. Right
It's
on.
kind of nice to do that. But in an emergency, you cut the hose, you stick it down.
You just go with what you got. Cool.
You bet.
Cool. Well, you all, this is the first of many presentations we'll be bringing you. We hope to have Dr. Jeff come back and spend some more time with us with his wealth of knowledge. So thanks for attending, and we look forward to seeing you next time.
Great. Thank you, Ruth.
My pleasure, Jeff.